Right now, in some high-tech laboratory, scientists aren't actually synthesizing a brand new chemical to treat heart failure.
Right, they're looking elsewhere.
Yet they're breaking down a really common thorny bush that you might, actually have growing in your own backyard.
Hawthorne.
Exactly, hawthorn. And they're finding that it works with the exact precision of a synthesized cardiac drug. Which is, we usually expect that kind of targeted chemical reaction to come from a clean, categorized pill bottle, right? Not a plant.
Oh, absolutely. I mean, historically, traditional herbal remedies have represented the absolute definition of diagnostic muddy waters for the modern scientific community.
Right, like old apothecary jars and folklore.
Exactly. Yeah, folklore and just a tremendous amount of guesswork. But the foundational premise we really need to establish right out of the gate is that scientific research is no longer passively observing these traditional
It's
herbs.
actively testing them.
Yes. It is actively validating them by identifying the exact biochemical properties and the precise mechanisms of action.
Well, welcome to the deep dive. Our mission for you today is to really bridge the gap between that ancient apothecary wisdom and rigorous modern clinical trials.
Because it's quite a gap.
It is.
Yeah.
So we are going to give you a shortcut to understanding the hard science behind traditional herbs so you can see exactly how these natural remedies hold up under a microscope.
Because we aren't just saying this plant makes you feel better anymore. We are looking at clinical data that identifies the exact molecules doing the heavy lifting.
Okay, let's unpack this because to
Yeah.
really understand how powerful these biochemical mechanisms are, we need to start with the foundational wear and tear of the human body.
To everyday damage.
Right, systemic inflammation and cardiovascular health. These are, the underlying biological fires that cause long-term issues. And a clinical data points straight to a very familiar spice as a heavy hitter here.
Turmeric.
Turmeric, yeah, or curcuma longa, and specifically its active compound, curcumin,
Right. And researchers have thoroughly zeroed in on curcumin. The clinical trials show potent anti-inflammatory and antioxidant properties.
which is huge.
It is. It demonstrates a real potential to reduce inflammation in debilitating conditions like osteoarthritis, rheumatoid arthritis, and even certain cancers.
I want to stop there for a second and look at the mechanism, because usually we just call something like curcumin a system-wide fire extinguisher and leave it at that.
Right. A nice, simple metaphor.
Exactly. But biologically, how is it actually putting out the fire in our joints?
Well, it really comes down to a specific protein complex called NFKB.
NFKB.
Yeah. Think of NFKB as the master alarm system inside your cells. When your body experiences stress or injury, this alarm goes off.
And then what happens?
It tells the cell's nucleus to start pumping out inflammatory cytokines, and those are the chemicals that cause swelling, pain, and redness.
Oh, I see. So the fire extinguisher isn't just randomly spraying foam everywhere to put out the inflammation.
Not at all, no. Curcumin actually crosses the cell membrane, walks straight into the command center, and blocks the activation of NFKB.
Wow.
Yeah, it literally switches off the master alarm. And by doing that, the body stops sending those inflammatory cytokines to your joints in the first place.
That's amazing.
We now understand the exact pathway it uses to halt the inflammatory cascade.
See, that level of precision completely shifts turmeric from, a piece of culinary folklore to a targeted cellular therapy.
Absolutely.
And the research highlights that it doesn't stop at the joints either. It actively supports cardiovascular health by improving endothelial function and reducing oxidative stress.
Right. And just to clarify for everyone, the endothelium is the delicate single-cell layer lining the inside of your blood vessels.
Right.
And oxidative stress is essentially cellular rust. It's unstable molecules called free radicals bouncing around and damaging that lining.
So where does curcumin fit in there?
It acts as an electron donor. It neutralizes those free radicals before they can rust the endothelium, allowing your blood vessels to stay flexible and operate with much less friction.
Protecting those blood vessels is obviously critical, but having perfectly clear pipes is only half the battle if the pump itself is struggling, right?
Very true.
Which brings us back to hawthorn, Crataegus monogena, which the research focuses on entirely for its role in improving heart function. It's essentially a tune-up for the heart's engine.
Yeah, the data on hawthorn is a brilliant example of targeted herbal efficacy. It physically enhances the strength and efficiency of the heart's contractions.
That's wild for a plant to do that.
It really is. It improves blood flow and can significantly reduce symptoms of heart failure.
Now, the specific bioactive compounds responsible for this are listed as flavonoids, quercetin, and procyanidins. What actually is a flavonoid in the context of tuning up a heart engine?
So flavonoids are plant chemicals that act as cellular messengers and protectors. In the case of quercetin and procyanidins in hawthorn, they interact with the enzymes in the heart muscle.
Okay, how so?
Well, they inhibit an enzyme that normally breaks down cyclic AMP. And cyclic AMP is a molecule that signals the heart muscle to contract.
Oh, so it keeps the signal going longer.
Exactly. By keeping those cyclic AMP levels higher, hawthorn ensures the heart muscle pumps with more vigor and efficiency.
Wow.
And simultaneously, it dilates the coronary arteries to ensure the heart itself gets enough oxygen. What's fascinating here is that we can name these exact compounds, quercetin and procyanidins, just sitting inside a plant, waiting to be utilized as a mechanical tune-up for a failing heart.
It's a kind of mind-blowing. It reframes how we view the natural world entirely.
It really does. However, physical wear and tear, like the systemic inflammation and cardiovascular strain we just broke down,
Yeah.
it doesn't happen in a vacuum.
No, definitely not.
It is deeply intertwined with the psychological factors.
The mind-body connection, right. Because you can't talk about physical inflammation without looking at the psychological stress and mental fatigue that triggers that cellular alarm system in the first place.
Exactly.
Which brings us to the concept of adaptogens, shifting our focus from putting out physical fires to rewiring the body's actual stress response.
Right. And in the scientific community, adaptogens are unique botanicals defined by their ability to enhance the body's resilience to external pressures.
They literally help the system adapt.
Yes, they help the physiological system adapt to stress.
And the undisputed heavyweight champion in this category, according to the clinical trials anyway, is ginseng, specifically Panax ginseng.
Oh, without a doubt.
The data focuses on its effects on energy, cognitive function, and immunity. And this isn't anecdotal, right? We are looking at meta-analyses of randomized controlled trials.
Yeah, that's the gold standard.
So for anyone listening who hits that 2 o'clock brain fog and reaches for their third cup of coffee, the trial suggests ginseng significantly improves cognitive performance and reduces mental fatigue.
Right, and a meta-analysis aggregates data across multiple rigorous studies, making the findings highly reliable. Ginseng isn't just providing a cheap caffeine spike that leaves you depleted later.
Which is what coffee does to me, honestly.
Same here. But ginseng is actively modulating the central nervous system to repair cognitive stamina. It also offers immunomodulatory effects, meaning it helps the immune system respond more efficiently to infections.
Okay, so on the completely opposite side of that adaptogenic coin, we have ashwagandha, or Withania somnifera.
Yes, very different mechanism.
Right, while ginseng energizes, ashwagandha has intense scientific backing for its ability to reduce stress and anxiety.
Tremendous backing, yeah.
The double-blind, placebo-controlled studies show participants taking ashwagandha extract experienced a massive reduction in cortisol levels and perceived stress, alongside improved sleep quality.
Cortisol being the primary stress hormone, of course. When it remains chronically elevated due to modern life, it just wreaks havoc on your sleep architecture and suppresses your immune system.
Right, and I understand the clinical outcome, lower cortisol, better sleep.
Yeah.
But I have to push back here a little bit.
Sure.
Biologically, how does a plant actually, know whether my system needs to be dialed up for energy with ginseng or dialed down for sleep with ashwagandha? Because that sounds like magic, not a biochemical mechanism.
It really does sound like magic until you look at the HPA axis, the hypothalamic pituitary adrenal axis.
The HPA axis, okay.
Yeah, that is the feedback loop between your brain and your adrenal glands. The plant doesn't actually know anything.
Okay, good.
Instead, compounds in ashwagandha, called withanolides, mimic some of the body's own calming neurotransmitters.
Oh, interesting.
When your hypothalamus senses stress, it usually tells the adrenals to flood your body with cortisol. But ashwagandha essentially steps into that feedback loop and signals to the brain that there is enough cortisol already.
So it tricks the brain.
Kind of. It triggers the negative feedback loop earlier. It literally forces the adrenals to stand down.
So what does this all mean? Well, if you think about it, adaptogens are essentially acting like a smart thermostat for your nervous system by manipulating that HPA axis.
That's a great way to put it.
Right. If your system is sluggish, ginseng turns the dial up. If your system is running too hot, flooded with anxiety and cortisol, ashwagandha steps into the feedback loop to turn the dial down, cool off the stress, and let you sleep.
And if we connect this to the bigger picture, it reveals a profound cascade effect. By regulating that cortisol and enforcing restorative sleep, you are actively creating a biological foundation.
Because without that sleep, everything else falls apart.
Exactly. Without that foundation, the cognitive and immune health simply cannot thrive. You are using the herbs to repair the underlying cellular environment so the body can do its job.
You build the baseline resilience first.
Yes.
But even with a perfectly tuned internal thermostat, things go wrong. Invaders breach the perimeter. You eat something that doesn't agree with you. You catch a respiratory bug.
Life happens, right?
Exactly. That is when the body needs more than daily resilience. It needs an immediate, tactical response to acute symptoms.
Which is where we shift from the daily maintenance of adaptogens to the targeted strike teams of the herbal world.
The strike teams. I like that.
Yeah, these are herbs studied for highly specific acute interventions.
And echinacea or Echinacea purpurea is the perfect example here. I mean, everyone sees echinacea drops at the pharmacy during cold and flu season.
They're everywhere.
Right. And the clinical trials confirm it reduces the duration and severity of the common cold, but it doesn't do this by just, like, coating a sore throat or masking a cough. It physically stimulates the production of white blood cells.
Specifically, it increases the activity of macrophages, which are the immune cells that literally swallow and destroy invading viruses and bacteria.
They just eat them.
Yeah. Echinacea contains compounds like alkamides that bind to receptors on these immune cells, activating them to move faster and engulf pathogens more aggressively.
Oh, that's a call to arms.
Exactly. It is rallying the defense forces at a microscopic level.
Wow. Then we have ginger, which is highlighted for its well-established clinical effectiveness for nausea.
Yes.
And the research points to proven efficacy, not just for a mild stomachache, but for morning sickness, motion sickness, and even chemotherapy-induced nausea.
Which is notoriously severe. The fact that multiple studies demonstrate ginger's effectiveness in that specific extreme scenario speaks volumes about its potency.
But how is a root stopping a chemotherapy-level nausea response?
It comes down to compounds called gingerols. You see, nausea isn't just a stomach issue, it's a gut-to-brain signal transmitted via the vagus nerve.
Right.
When the stomach is irritated, serotonin is released, which binds to 5-HT3 receptors in the gut, sending a vomit signal to the brain.
So it's an alarm bell, basically.
Right. And gingerols physically block those 5-HT3 receptors. If the receptor is blocked, the serotonin can't bind, the vagus nerve doesn't fire, and the nausea signal never reaches the brain.
That is incredible. It is just intercepting the communication line entirely.
It really is.
Rounding out this strike team is peppermint, Mentha piperita. Clinical trials confirm peppermint relieves symptoms of irritable bowel syndrome, or IBS, by directly reducing spasms in the gastrointestinal tract.
And the mechanism there is equally precise. The menthol in peppermint physically blocks calcium channels in the smooth muscle lining of the colon,
Calcium channels, right?
because muscles need calcium to contract. By blocking those channels, the menthol forces the intestinal muscles to relax, completely stopping the painful spasms associated with IBS.
Wait, so is a casual cup of peppermint tea or chewing on some raw ginger enough, or does the science point to something more specific for actual measurable efficacy?
That distinction is crucial. Traditional methods, like a cup of tea, are wonderful comforting practices, sure, but they are highly variable.
You don't really know what you're getting.
Exactly. The temperature of your water, the soil the plant grew in, the steeping time, all of these drastically change the chemical composition.
That makes sense.
To get clinical results, the kind that yield measurable outcomes for something like IBS or chemo-induced nausea, it absolutely relies on proper implementation.
So a cup of tea is nice, but it isn't the clinical strike team.
It isn't, and that perfectly tees up the core of how this science is actually applied responsibly in the real world, which is evidence-based herbal practices.
Here's where it gets really interesting, though, because we need to challenge a massive misconception. There is a very pervasive idea out there that natural automatically equals safe.
Oh, yes. Very common.
But this evidence-based approach is incredibly strict. It relies on scientific research, clinical data, standardized dosages, and rigid safety profiles.
It has to.
Right, while heavily weighing a person's age, health status, and existing conditions. It treats these plants like the powerful biological manipulators they actually are.
And the term standardized dosages is the absolute linchpin of evidence-based practice here.
What does that mean practically?
It means extracting the active compound, like the curcumin, the gingerols, or the menthol, and testing it to ensure that every single dose contains the exact same scientifically proven amount of that active ingredient.
Okay, I see. And the research highlights milk thistle, or Silybum marianum, as a prime example of this evidence-based practice, specifically for liver support.
Yes.
The active compound is silymarin. The clinical documentation shows that silymarin physically protects liver cells, promotes their regeneration, and reduces liver enzyme levels in serious conditions like fatty liver disease and hepatitis.
Because the liver is the body's primary filtration system,
Right.
processing every toxin we encounter.
It works hard.
It does. And silymarin protects it through two highly specific mechanisms. First, it alters the outer membrane of the liver cells so that certain toxins literally cannot penetrate the cell wall.
It builds a shield.
Exactly. And second, it stimulates an enzyme called RNA polymerase I, which drastically speeds up protein synthesis.
Ah, so it speeds up the cellular assembly line.
Yes. It forces the liver to generate new, healthy cells faster than the disease can destroy them. You don't want to guess with liver disease using a random unmeasured T.
No, definitely not.
You want the exact standardized compound proven to stimulate that RNA polymerase.
The research also features valerian root, Valeriana officinalis, which is heavily supported by studies for promoting sleep and managing insomnia.
Right.
And it does this by interacting with GABA, an inhibitory neurotransmitter in the brain, essentially calming the nervous system down.
This raises an important question about how anyone listening manages their own wellness routines. When people assume natural is always safe, they risk severe interactions with prescription medications or taking entirely incorrect doses.
Which can be really dangerous.
It can. Professional herbalists and clinical practitioners rely on these standardized, evidence-based protocols because they completely remove the guesswork. They base recommendations on hard biochemical data.
It strips away the folklore and leaves us with calculated science. We have covered tremendous ground today, taking a journey from the very foundation of physical wear and tear to the strictest clinical standards. We looked at how curcumin acts as a fire extinguisher by shutting off the cellular alarm system, and how the flavonoids in hawthorn act as a mechanical tune-up for a failing heart engine.
And we explored how adaptogens like ginseng and ashwagandha manipulate the HPA axis to turn our energy dials up or our stress dials down.
And then we broke down the tactical strike teams, echinacea rallying white blood cells, gingerols blocking nausea signals, and peppermint blocking calcium channels to stop spasms.
Which is just a staggering amount of cellular manipulation from plants.
It really is. And finally, we landed on the absolute necessity of evidence-based practice, where compounds like silymarin are standardized to guarantee they actively regenerate liver cells. For you listening, having this depth of knowledge is your shortcut. In an era of absolute information overload, where, every wellness influencer is pushing a new magical remedy on social media, understanding the hard science, the actual mechanisms of action gives you the power to make informed, confident decisions about your own well-being.
You aren't guessing anymore.
Exactly.
Oh.
You know exactly why and how it works.
We started by comparing the expected precision of synthesized drugs against the perceived murky waters of traditional herbs.
Right.
But the clinical data leaves us with a truly profound realization. Modern double-blind studies are uncovering the exact biochemical mechanisms proving these ancient remedies were highly targeted therapies all along.
They really were.
It really leaves you wondering, if science is just now isolating the specific mechanisms of hawthorn and turmeric, how many other common weeds growing right now in our backyards are just waiting for a clinical trial to unlock their hidden medical potential?
Oh man, that makes you look at the natural world entirely differently. The diagnostic microscope isn't broken when we look at traditional herbs. We just finally figured out how to adjust the lens.